Today we're going to talk about knee pain. Knee pain is a fairly common problem with a more complex solution. The reason why it gets so complicated is the fact that the knee is more or less considered by many as a circuit breaker to the lower limb. And what this really means is, in other terms, is anywhere along the line down the leg, if there's a problem with a joint or a muscle, the knee can eventually take the brunt of this force and develop an injury later on down the line. So if there's a problem with the hip, the knee can be affected from that. If there's a problem with the ankle, the knee can also be affected from that. So this, as the saying goes, the knee's more or less stuck in the middle with nowhere to go, and this is the way it kind of goes with overuse injuries. There are different injuries where you can develop ACL tears, MCL tears, stuff like that is from a direct trauma or a forced injury. This presentation doesn't really address those causes, but from an overuse standpoint, it's usually from a joint, one of the joints above or below. So you may be wondering, what are some things that can happen at the hip or the ankle to cause knee pain or overuse problems at the knee? Well, fibrous adhesions or scar tissue can build within these joints, decreasing their range of motion and altering the biomechanics and closed chain activities, or the way you walk or run, basically. This causes that abnormal stress upon the knee, and it will lead to knee injuries eventually. So let's take a look at the ankle and see how the ankle can develop a knee problem. So imagine how someone sprained their ankle. They're not moving it as well, they're limping, they're very tender about the way they walk. So if months down the line, this is still going to be a problem because they still have that scar tissue and loss of range of motion in the ankle. So think about push-off first of all. Push-off, usually a lot of force production happens at the ankle, and if this force production is not produced there, eventually it's going to have to be produced somewhere else. Those spots are at the hip and the knee, so that can lead to abnormal demand upon the knee and develop an injury. Second part is that with heel strike, a lot of the impact from the heel on the turf or concrete, whatever you're running on, is absorbed through the calf and through the ankle. And if that ankle doesn't have that range of motion anymore, then it's not going to absorb that impact. And where is it going to be absorbed? The next spot up, right at the knee. So let's consider now an injury at the hip and how that can cause knee pain. Well, imagine you strained your hamstring or you tore your hamstring and you still want to train months down the line. Your body is really going to favor that primary area of injury, and it's not really going to give a care in the world what happens to your knee. So that's really how your body's going to compensate the biomechanics, and your knee's just going to take the hit for all this stuff. To find out the primary cause of your knee pain, you should really seek the care of an active release technique or an ART provider. ART is fairly unknown to the general population, but is very popular in professional sports. In fact, most teams in the NFL, NHL, NBA, all these associations all have ART providers for each and every team for the city that they go to. A lot of Olympic athletes have also used active release and found great success with that. ART has been considered an alternative surgery in many cases of knee pain, shoulder pain, carpal tunnel syndrome, sciatica, and low back pain. People respond very well to active release technique in these cases, and the reason being is because ART is the most efficient way at reducing the amount of scar tissue within joints or within muscles that surround the joints. This thereby leads to an increase in range of motion and a decrease in strain upon the knee if we're still talking about the knee. Many patients will respond favorably to ART within about 3 to 4 treatments of about 15 minutes or so. If during this time they don't respond very well during that amount of treatments, sometimes we refer them out because it's something that ART can't fix. Most cases of knee pain can be resolved within about 6 to 8 or 8 to 10 treatments depending upon the severity of the case, and it varies from person to person. But regardless, many people find great success by using ART to solve their knee pain. For more information on different types of conditions, please visit my other demonstrations or visit my website. For more information on active release technique, please visit www.activerelease.com. So I'm going to show you a little bit what it's like to be treated by an active release provider on your knees. So go ahead and extend this knee for me. Pretty much all I'm going to do is just contact and we're going to stretch the muscle. It's going to release some of the scar tissue within that joint, increasing its range of motion. And you see, the reason why I'm showing this is because ART is kind of a hard thing to talk about, but when you see it done, you just see it. It's not anything tricky. And some patients will be a little sore afterwards for about 48 hours, but they really usually notice an increase in range of motion and a decrease in pain immediately after the treatment.